This is a presentation on assessment and anxiety disorders by Amna Ali, Sumati Buru, Shan Boziak, Seychelle Ruplal, and Latricia Mears.
Factors in mental disorders. Mental disorders, also known as abnormal behavior, can be caused by several different factors, whether it be biological, which is comprised of neurological and genetic factors, or cognitive, emotional, behavioral, and environmental factors. This can be defined as a recurring problem that interferes with an individual's ability to live a personally satisfying life and function normally in society. Biological factors are composed of genetic and neurological factors. Genetic factors being the things that contribute to the development of mental disorders, whether unlearned or inherited, and influences how a person thinks, feels, and behaves. Genetic factors also affect the development of the brain. Neurological factors consist of having an overactive brain structure that can contribute to the development of a mental disorder by causing someone to see the world in a distorted way and to see things that aren't really there. Behavioral factors. These contribute to the development of mental disorders, including deficits in cognitive processes and a lack in processing emotional stimuli. It also fully explains why people develop mental disorders, unlike biological factors. This means that these factors have a greater understanding for those who have unusual thoughts and beliefs, and as a result, reactions to certain situations are understood. Environmental factors. Environmental factors can take place in times of traumatic experiences such as war, car accidents, assault, rape, muggings, and so much more. This can cause long-lasting emotional disorders, also known as post-traumatic stress disorder. PTSD, post-traumatic stress disorder, can cause persons to relive their terrible events through memories and nightmares, and sometimes may even require professional help depending on the severity of their emotional problems. This PTSD experience is one of the ways in showing how traumatic environmental factors can contribute to the development of serious mental disorders, as it interferes with your entire life and can increase or induce other mental health problems. Abnormal behavior. Abnormal behavior can be shown in the case of Dennis Rader, also known as the BTK killer, who showed abnormal tendencies. He was aware of right and wrong when he killed his victims, but did it regardless because of the feeling he got when he killed. 3 approaches fall under the topic of abnormal behavior, and they are statistical frequency, social norms, and maladaptive behavior. An example of the statistical frequency approach is living in a storm drain would do no harm to anyone except violate a city law. This preferred living style was used by Thompson and could be considered abnormal according to this approach. An example of the social norms approach would be: based on this approach, the decision to live in a sewer can be deemed as abnormal because it deviates from society's norms about where people should live. Examples of maladaptive behavior approach are hearing voices that control dangerous acts, serial murders, anorexia nervosa, and so much more.
Assessing mental disorder. It's often difficult to identify exactly what a person's motivation and mental problems are. Let's take Susan Smith for example. She first confessed that her sons were kidnapped, but 9 days later she confessed that she had drowned them. Everyone was stunned after learning the truth and had questions like how could she kill her own children? In order to get answers to these questions, Susan had to be evaluated by a mental health professional through a procedure called the clinical assessment. The clinical assessment involves a systematic evaluation of an individual's various psychological, biological, and social factors, as well as identifying past and present problems, stresses, and any other cognitive or behavioral symptoms. A clinical assessment would be the first step in figuring out which past or current problems may have contributed to Susan killing her own children. How would Susan be evaluated? In order to evaluate Susan's behavior, the mental health professional would use 3 methods of assessments. The 3 methods include neurological tests, clinical interviews, and psychological tests. In terms of the neurological testing, they would want to know if Susan had neurological problems. Neurological tests are used to distinguish physical or organic causes from psychological ones. However, upon completion of these tests, it was reported that she had no neurological problems. Clinical interviews. When we talk about clinical interviews, we talk about a method of gathering information about a person's past and current behaviors, beliefs, attitudes, emotions, and problems. Clinical interviews can be both structured or unstructured. Psychiatrists spend many hours interviewing Susan. During the interview, she was asked about the history of her current problems. They discovered Susan was scarred by her father's suicide and her stepfather sexually abusing her, which had led to periods of depression. Also, in terms of her current problems, she suffered from severe depression, drinking, and an adjustment disorder. Psychological tests. Psychological tests are done through personality tests. A personality test includes 2 kinds of tests: the objective test and the projective test. After these assessments were completed, Susan was diagnosed with having a mood disorder. How was Susan diagnosed with a mood disorder? Through the Diagnostic and Statistical Manual of Mental Disorders for text revision, she was given a clinical diagnosis. The DSM-4-TR describes a uniform system for assessing specific symptoms and matching them to almost 300 different mental disorders, while a clinical diagnosis is a process of matching an individual's specific symptoms to those that define a particular mental disorder. The DSM-4-TR has 5 major dimensions called axes. Axis 1 deals with 9 major clinical syndromes. These include disorders usually first diagnosed in infancy, childhood, and adolescence, organic mental disorders, substance-related disorders, schizophrenia and other psychotic disorders, mood disorders, anxiety disorders, somatoform disorders, dissociative disorders, and sexual and gender identity disorders. Axis 2 deals with personality disorder in terms of personality traits. Axis 3 deals with personality disorder in terms of physical disorders or conditions. Axis 4 deals with psychosocial and environmental problems. And Axis 5 deals with global assessment of functioning scale. The usefulness of DSM-4-TR Mental health professionals and researchers use the classification system to study and explain mental disorders. Therapists use the classification system to design their treatment program so as to best fit a particular client's problem. Now, there are problems with this system in that mental health professionals do not always agree on whether a client fits a particular diagnosis, and there may be social, political, and labeling problems.
Anxiety disorders. How common is anxiety disorder? The most common mental disorder reported by adults in the United States is any kind of anxiety disorder reported according to the graph below. Generalized disorder, also known as GAD, which is characterized by excessive or unrealistic worry about almost everything or feeling that something bad is about to happen. These anxious feelings occur on a majority of days for a period of at least 6 months. Symptoms include both psychological and physical symptoms, with psychological symptoms being irritable, having difficulty to concentrate, being to control, worrying, whereas physical symptoms is restlessness, fatigue, sweating, insomnia, pounding heart, and flushing. Treatment is treated with psychotherapy with or without drugs. Panic attack. It is a period of intense fear or discomfort in which form of the following symptoms are present: pounding heart, shortness of breath, nausea, feelings of choking, and feeling dizzy. Panic disorder, when the person becomes too worried about having another panic attack. That intense worrying interferes with normal psychological functioning. It is also characterized by recurrent and unexpected panic attacks. Panic disorders are usually treated with drugs such as antidepressants. Phobias can be characterized by an intense and irrational fear that is out of all proportion to the possible danger of the subject or situation. Because of this intense fear, which is accompanied by increased physiological arousal, goes to great lengths to avoid the feared event. If the feared event cannot be avoided, the person feels anxiety. Common fears we have, like seeing blood, spiders, meeting new people, getting injections, being in small places or big places, and so on. Social phobia. It is characterized by irrational marked and continuous fear of performing in social situations. The individuals fear that they will humiliate or embarrass themselves, such as eating in public, speaking to strangers. Specific phobias are characterized by marked and persistent fears that are unreasonable and triggered by anticipation or of exposure to a specific object or situation. Examples like seeing spiders, flying, and heights. Agoraphobia is characterized by anxiety being in places or situations from which escape might be difficult or embarrassing. If a panic attack or like a panic like symptoms that include dizziness or onset diarrhea, such as public transport and being in crowds. Obsessive compulsive disorder consists of obsession, which are persistent, recurring, irrational thoughts, impulses, or images that a person is unable to control and that interfere with normal functioning, and compulsions, which are irresistible impulses to perform over and over some senseless behavior or ritual like hand washing, checking things, and counting. Treatment for this can be something called exposure therapy, which involves gradually exposing the person to the actual anxiety producing situations or object that he or she is attempting to avoid, and continuing the exposure treatments until the anxiety decreases. Post-traumatic stress disorder, so known as PTSD, is a disabling condition that results from personally experiencing an event that involves actual or threatened death or serious injury, or from witnessing or hearing of such an event happening to a family member or close friend. These symptoms include recurring and disturbing memories, intense fear, anxiety, and terrible nightmares.
Somatoform disorder. Somatoform disorders are marked by a pattern of recurring, multiple, and significant bodily or somatic symptoms that extend over several years. The bodily symptoms, example pain, vomiting, paralysis, blindness, are not under voluntary control, have no known physical causes, and are believed to be caused by psychological factors. There are 7 kinds of somatoform disorders. 2 of the more common forms are somatization and conversion disorders. Somatoform disorder, which was historically called hysteria, is now called somatization disorder. Somatization disorder begins before age 30, lasts several years, and is characterized by multiple symptoms including pain, gastrointestinal, sexual, and neurological symptoms that have no physical causes but are triggered by psychological problems or distress. This disorder is especially common among women. Many people with somatization disorder are raised in emotionally cold or unsupportive family environments and are often victims of emotional or physical abuse. Somatization disorders may be means of coping with a stressful situation or obtaining attention. Conversion disorder refers to changing anxiety or emotional distress into real physical, motor, sensory, or neurological symptoms. Example, headaches, nausea, dizziness, loss of sensation, paralysis, for which no physical or organic cause can be identified. Symptoms of conversion disorder are associated with psychological factors such as depression, concerns about health, or the occurrence of a stressful situation. Treat the development of such physical symptoms by getting the person's attention, remove the person from the threatening or anxiety producing situation, and thus reinforcing the occurrence and maintenance of the symptoms involved in the conversion disorder. Condition experienced by a group of people who, through suggestion, observation, or other psychological processes, develop similar fears, delusions, abnormal behaviors, or physical symptoms. In the Middle Ages, hysteria was attributed to possession by evil spirits or the devil. Today, mass hysteria is known to involve members of a group who experience and share emotional arousal or excitement which spread through the group and results in its members developing real physical symptoms with no known causes. The same kind of painful or uncomfortable physical symptoms observed in somatoform disorders are observed in individuals suffering from mass hysteria. Cultural values. The Japanese culture places great emphasis on the appropriate way to conduct oneself in public, which means a person should avoid making direct eye contact, staring, blushing, or having trembling hands or giving off offensive odors. In comparison, although many Westerners are also concerned or embarrassed about offending others through staring, having offensive body odors, or blushing, however, making eye contact is very common in Western cultures. If you do not make eye contact in social interactions, you may be judged as being shy or lacking in social skills. Can a culture create a disorder? It's true that the unique cultural values of some countries, such as Japan, can result in the development of a unique anxiety disorder not found in Western cultures, such as the United States. If you had a social phobia in the United States, it would usually mean that you had a great fear or were greatly embarrassed about behaving or performing in social situations, such as making a public speech. But if you had a social phobia for several Asian cultures, especially Japan and somewhat in Korea, It might mean that you had a very different kind of fear or embarrassment called Tai Jin Koi Fo Sho. Tai Jin Koi Fo Sho, or TKS, is a kind of social phobia characterized by a terrible fear of offending others through awkward social or physical behavior such as staring, blushing, giving off an offensive odor, having an unpleasant facial expression, or having trembling hands. The graph below shows that TKS is the third most common psychiatric disorder treated in Japanese college students, TKS being 19%. Although people in many cultures report anxiety about behaving or performing in public, the particular fears that they report may depend on their own culture's values. Clinicians emphasize that the importance of taking cultural values, influences, and differences into account when diagnosing behaviors across cultures.
Research focus: school shooting. What is the problem? Conduct disorder, which refers to the repetitive and persistent pattern of a behavior that has been going on for at least a year, violates the established social rules or the rights of others. Problems may include aggressive behaviors such as threatening to harm others, abusing or killing animals, destroying property, being deceitful, and stealing. Risk shared by adolescent school shooters. While the number of differences vary among school shooters, researchers have found and identified a number of risk factors that these students, boys, shared. Most of the shooters, boys, showed uncontrollable anger and depression, often blame others for their problem, and threatened violence. Most had poor coping skills and discipline problems at home and school, had access to weapons, and had a history of drug use. Half of the boys who committed these violent acts had little supervision. They had trouble with their family relationships. They perceived their family as giving them no support. Most of the boys experienced the brokenness of a relationship, a stressful event, or loss. Most of these boys were generally isolated or rejected by their peers. They had poor social skills and was often bullied, picked on, persecuted, and their friends were antisocial. They enjoyed violent movies and seek justice for peers or adults who they believed did them wrong. Most teen shooters gave warning signs of their violent intention, but they were never taken seriously. Neurological factors. Although coming from a broken home, being bullied and having stressors are risk factors for adolescents committing violent acts. Another important factor is what goes in their brain. Everyone gets angry and has rage, but most of us are able to control these violent impulses. Treating phobias. What is a phobia? An extreme or irrational fear or dislike of a specific thing or group. Cognitive behavioral therapy. This involves using a combination of two methods: changing negative, unhealthy, or distorted thoughts by being positive, or changing limited or disruptive behaviors by practicing new skills. Thoughts. Thoughts are very useful in controlling fears, such as with Kate and her fear of flying. For example, she was taught what to expect when the plane takes off or lands. Behaviors. Because of Kate's fear for flying, she is often nervous.
Deep and rhythmic breathing is an effective calming exercise because it distracts the fear. Imaginary exercise are calming and a very powerful way of using her mind to control her body's fight flight response. Cognitive behavioral methods have proved effective in the treating of a variety of phobias. Exposure therapy. This is gradually exposing the person to the real anxiety producing situation or objects that he or she is attempting to avoid and continuing exposure until the anxiety decreases.
Here are two activities based on assessment and anxiety disorders. So let's play bingo.